Da 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 da. Da 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 da. See that? Bogey's mama. Bogey's mama. Who commented earlier, he's a disgusting pig. But then comes back, I hardly know anything about you. Why are you in my comment section? Well, this is why. No such thing as stage 1 prostate cancer, and apparently her husband had beet cancer, so she knows all about it. She knows all about it. I'm glad for him, though. But there's no such thing as stage 1 prostate cancer. There's no such thing. No doctor would have told me that because there's no such thing, right? Well, all you gotta do is look. All you gotta do is click a couple times, by God, and you'll find it. You'll find it if you just click a couple times. But instead, you want to sit on YouTube and make stupid comments about somebody you know very little about, right?
Including important warnings.
These are the treatment for stage 1 prostate
What did he
cancer.
say? What did he say? Wait.
Prostate cancer. These are the treatment for stage 1 prostate cancer. These are the treatment for stage 1 prostate cancer. These are the treatment for stage 1 prostate cancer. First of all, I think it's best to define what stage 1 prostate cancer is.
I guess they know more than the doctors do. What does it say? MD, Arizona State Urology. But maybe we'll just believe somebody that's sitting on YouTube, right? They don't even stage prostate cancer that way. Not this guy. This guy right here is a scammer. This guy, he don't know what he's talking about. It's those 12 people over there know what they're talking about.
And that's usually a cancer of the prostate that is detected more than likely by an elevation in the PSA.
Which I went through earlier in my video where you show my medical records. They saw an elevation in my PSA. All right. And I explained all that. You can go back and look at my other video. I already explained this. This is what they thought. And he shot off and told me.
And a PSA is a blood test that we use to screen men for prostate cancer. And traditionally in the past, if that level was above 4,
I was at a 5. And I showed it. Go back and look.
That would usually signal a referral from a primary care doctor to the specialist. More recently, we've also tracked the trend in which the PSA changes. If that PSA is rising quickly, even though it's under 4.
Now do I have to go back to get my other video and show you where it was? It was at a 5. That's why the doctor told me this.
And that would also trigger an evaluation as well.
Okay, so they did the evaluation and they jumped the gun and told me that it was stage 1 prostate cancer.
So what you're primarily dealing with is a process in which the cancer is confined within the prostate, and that in most cases, it's something that we cannot actually palpate or feel a nodule. So, the treatment options sort of...
That's what I said. It was so small that they couldn't tell. He said if it's anything, it's so small to be stage 1.
It depends on, first of all, the age of the patient.
55.
As well as their overall health.
I've got prediabetes, hyperglycemia, extreme chronic hypertension, okay, plus this degenerative disc disease with osteoarthritis in my hip and in my mid back.
If someone is a young individual with relatively in good health, then usually the options include surgical removal of the prostate. And the other option would probably include some form of radiation therapy as an alternative. There are also other treatments which include what we call cryotherapy, which basically involve freezing of the prostate. That tends sometimes to be more reserved for patients who are low. Treatment for stage 1 prostate cancer. Treatment for stage 1 prostate cancer. Treatment for stage 1 prostate cancer. Treatment for stage 1 prostate cancer.
Anything else? And I said when the PSA levels are high, and I already showed that. Now there's a doctor saying it. Jackasses. Anybody else? Anything else? Bunch of dunce caps.